Hi, my name is Jessica.
And I'm Araceli.
Together, we are leading a quality improvement initiative called 4 Eyes in 4 Hours. And the next few minutes, we want to walk you through what this practice is, why it matters for our pediatric patients, and what it will look like at the bedside.
Hospital-acquired pressure injuries are one of the most serious and most preventable complications our patients experience. In pediatric ICUs, up to 27% of patients develop pressure injury during their hospital stay. And over 80% of those injuries are caused by medical devices, equipment we use every day, like respiratory support, monitoring leads, and things we use to secure them.
These injuries can cause real harm. They cause pain, they prolong hospital stays, and in some cases, they leave children with scars that last well beyond discharge. The hardest part is that most of them are preventable when caught early.
4 Eyes in 4 Hours is a standardized two-nurse collaborative skin assessment completed within 4 hours of every admissions and every transfer. Both nurses inspect the skin together, head to toe, including under every medical device. The primary nurse documents the findings and notes the name of the second nurse who participated.
The principle is simple. Two sets of eyes catch what one set of eyes might miss, especially under devices, in skin folds, on the back of the head, on the back of the body, where injuries often hide.
Pediatric patients are uniquely vulnerable. Their skin is thinner, the dermal circulation is still developing, and their body surfaces are smaller in relative comparison to the devices we use on them. The areas most commonly affected are the face, the ankles, the feet, and the back of the head, places where small devices sit for hours.
This is not a new practice at UCSF. Adult services have been performing a 2RN admission skin assessment for years, and it is part of their standardized workflow. What we are doing is extending that proven practice to our pediatric population. In the video that follows, you will see exactly what 4 Eyes in 4 Hours looks like at the bedside. Pay close attention to how we set up the assessment together, how we inspect under devices, and how we communicate findings before documenting.
Thank you for being part of this work. Let's take a look.
Hey, Araceli, I just got a new admit. Can you help me with a 2RN skin check?
Yeah, of course. Great. Let's go.
Okay, Lulu, we're gonna do our 2RN skin assessment. I already let the parents know, and I made sure that there was plenty of natural lighting, which is helpful for all skin tones. So we will go ahead and start with the face mask. So first we're gonna take off all medical devices and look under the medical devices. Look behind the head, feel for any fogginess or notice any color changes. I didn't see anything that was concerning. Did you, Araceli?
I did not, I agree.
Okay.
Okay, checked under the ears, behind the ears too.
Okay. There's an IV here, so I'm gonna make sure to look under the hub of the IVs to make sure that there is no indentations or any skin breakdown. I don't notice any.
Looks good. Now we'll check the blood pressure under the blood pressure cuff.
Okay.
Okay, seems good.
Checking under elbows, checking under all bony prominence in between fingers. Next, we will go ahead and check under the EKG stickers, make sure that there is no marks related to the leads being on for too long. I don't notice any. We're gonna go ahead and move down to under the diaper. We're gonna make sure that there's no skin breakdown or maceration from being in the diaper for too long. We'll check the coccyx and the buttocks area. I'm gonna remove the Mepilex. I don't notice any blanchable erythema. I don't notice any skin breakdown. Checking all bony prominences, shoulders, the spine area, the coccyx area, and the sacrum. Next, we're gonna check under the heels. I don't see any breakdown or blanchable erythema under heels. We're also going to be sure to remove the SpO2 monitor or any other devices. And again, I don't see any breakdown. Araceli, do you agree?
I agree, there's no skin breakdown. We also check under any skin folds throughout the skin check.
Okay, great. Now that we both agree on our assessment, we'll go ahead and document.
Sounds Good training.
things. So we'll start with integumentary, and we are going to say that it's within normal limits and that the S2RN skin assessment was completed. And then what I'm gonna do is I'm going to type in the name. So Araceli is who helped me with my skin assessment, so I will just document Araceli. All right, and file. Now that you've seen a 2RN skin assessment for admissions in action, I just want to give you a couple of friendly reminders. If at all during your assessment you identify any wounds, pressure injuries, or any disruption of the skin integrity, be sure to follow your unit's policy and procedure for skin breakdown, such as making sure to document and add the LDA to your avatar. Make sure to take a photo with the Rover app and attach it to the patient's chart. And also be sure to consult the wound care team as indicated. Thank you so much for everything that you do.